Not surprisingly, as with all deviant behaviors, there are many consequences to violence. And when it occurs in the context of healthcare, those consequences impact not only the first line victim. These consequences range from those impacting, firstly, on individual healthcare professionals, secondly, on their colleagues and the organizations in which they practice, and thirdly, on the patients and clients being served. Consequences are discussed from these three perspectives. At the level of the individual professional experiencing the violence, there is the obvious physical injury that can be incurred, as well as possible fear of the assaulting party. Violent events or threats that do not necessarily cause physical harm to the healthcare worker, particularly if they occur repeatedly, may also have long lasting psychological consequences, including feelings of shock or disbelief, shame, guilt, anger, self blame, and powerlessness on the part of the victim. Each of these can contribute to the phenomenon of the underreporting of violence, which will be discussed in a subsequent unit. Sleep disturbances, chronic fatigue, as well as clinical depression and or anxiety, and other psychological symptoms have also been reported in situations of workplace violence. Self-medication is sometimes utilized to dull or live with violence, particularly where reporting does not seem like a viable option for its resolution. Furthermore, it has been shown that these reactions to workplace violence can last much longer than the time during which the victims are away from work or healing from their physical injuries. In the event that violence is repetitive and hence cumulative, or if or when reports of violence are not followed by adequate employer support, symptoms such as burnout, diminished self-esteem, and sense of professional competence and worth can result. Social isolation, avoidance behavior which may affect the performance of duties, and negative repercussions on interpersonal relationships, both at work and at home, are also symptoms of psychological trauma. The greater the severity and the frequency of all forms of violence, the greater the possibility of significant psychological trauma. Not surprisingly, given its impact on individuals, the consequences of workplace violence are also evident at the organizational level. Deterioration of staff health results in increased absenteeism and low work unit cohesiveness. Effective teamwork, of course, is a documented requirement for a healthy workplace and effective provision of services. Increased costs for sick time and insurance plans, including the cost of potential legal proceedings from victims, are also engendered. Research conducted in Sweden found that the combination of productivity loss by the victim of violence and the costs associated with interventions from third parties may amount to as much as $100,000 in 1990 dollars per year per individual case of harassment at work. If this is in fact true, costs in today's currency would be staggering. As previously alluded to, increased levels of workplace violence and insufficient attention to it by employers will also inevitably result in deterioration of workplace climate and culture, which engenders its own set of problems. Low worker morale in the face of workplace violence and its potential mismanagement result in high turnover and the abandonment of healthcare professions by workers, which prompts increased recruitment and orientation costs, and in a vicious cycle phenomenon, further deterioration of workplace climate. From a societal perspective, it appears that there may have been an increase in tolerance for violence, particularly psychological violence. This is evidenced by the fact that in Canada and elsewhere, legal systems in the past have refused compensation to health professional victims, contending that they accept the risk of violence as part and parcel of choosing to practice in healthcare. The fact that healthcare professionals often cite that violence is part of the job, quote unquote, as the reason why they do not report it when it occurs. This situation results in the perpetuation of unacceptable societal behaviors and makes it difficult for this problem to be addressed. The presence of injured and or psychologically compromised healthcare providers can result in decreased work performance, resulting in compromised patient-client health outcomes as relates to the actual quality of the care provided. In fact, most nursing studies into the effects of workplace violence is focused on nurses' perceived ability to care for patients following abuse and typically includes reports of impaired job performance, increased error, and decreased productivity, which of course can result in care being delayed and or not happening at all. One nursing study even demonstrated that where a constructive and healthy work culture is present, that is, presumably where violence, particularly of the horizontal kind, is minimal, that there is decreased mortality of patients. As will be discussed in a subsequent unit, legislators who regulate and provide funding, agency administrators who develop and enforce policies, as well as regulatory colleges whose role it is to protect and serve the public, clearly need to be attentive to this. Unit 3 discusses the sources of violence as well as the ambient organizational characteristics that have been reported to be antecedents of violence.